Okay, very good morning, everybody. After the nice slides that Dr. Naveen Thakkar showed, I'm going to just give you a snapshot of the measles elimination and congenital rubella syndrome elimination control, because for measles, I'll just explain that a little later why I am writing elimination versus control for rubella, while for measles I'm writing elimination. I'm just going to be talking about the global situation as well as talking a little bit about what is happening in Southeast Asia where India lies. So just to start with the global and regional milestones as far as measles and rubella is concerned, taking back all of you to the World Health Assembly of 2010, where the Assembly decided that by 2015, this was the milestone that was set in 2010, that by 2015, all countries should be achieving 90% or more with the first dose of a measles-containing vaccine, that is MCV1, that's what we refer to as, and have at least 80% coverage with the first dose of a measles-containing vaccine in every district of every country in the world. So that was the first milestone that was set. The second milestone that the World Health Assembly in 2010 decided was to reduce the measles reported incidence to less than 5 cases per million population. And the third milestone was to reduce the measles mortality reduction by 95%, using the 2000 number as the baseline. So these were some of the milestones that were set in 2010 during the World Health Assembly. And then came the Global Vaccine Action Plan that was also endorsed by the World Health Assembly. This was the plan that lasted for 2012 to 2020. And then the Global Vaccine Action Plan also had goals related to measles and rubella. What it said as part of one of the 6 goals of the Global Vaccine Action Plan was that by 2015, we should be eliminating measles in 4 WHO regions, and we should be eliminating rubella in 2 WHO regions by 2015, and by 2020, we should be eliminating measles and rubella in at least 5 of the 6 WHO regions. So I'm showing you these as the starting point so that you know that this was what was decided in one of the or 2 of the biggest forums for where measles and rubella was discussed. Now, when we look at the regions of WHO, there are 6 WHO regions, and they're shown in 6 different colors on these maps. The yellow ones, as you can see on the left, are the American regions, so they are the Americas. And then there is the European region, there is the African region, there is the Southeast Asia region, which is shown in red, where India lies. There is the Eastern Mediterranean region, and there is the Western Pacific region. And there are also numbers that are written on each of these regions, as you can see in the boxes. The ones in the black or the dark blue are the goals that these regions have set for measles elimination. The ones in a reddish color or a pinkish color are the years that these regions have set for elimination of rubella in these regions. So for example, the American region that you see on the extreme left, in the yellow, the year 2000 was the year when the American region decided that they would eliminate measles, and 2010 was the year decided to eliminate rubella from the American region. Now you look at the red portion, which is the Southeast Asia region, which is where India lies. The region has a goal of 2020 for measles elimination. The region does not have a goal for rubella elimination as of now, and therefore we put written control. So the goal for the Southeast Asia region is to eliminate measles by 2020 and control rubella and congenital rubella syndrome by 2020. So for measles, all the 6 regions have an elimination goal. As you can see, there is a goal for each of these regions. Now, whether that has been met or not is a different story, and we'll come to that a little later. And there are 3 regions out of the 6 regions that have a rubella elimination goal. Now, when we say rubella elimination goal, it is primarily to eliminate the rubella virus transmission and therefore cut down the congenital rubella syndrome, the pictures that you just saw from Naveen showing those. So that's the as far as the goals are concerned. Now, looking at where we are in terms of each of these milestones. So the global milestone number 1 was to achieve 90% or more with the first dose of a measles containing vaccine in every country. And you see on the map, the coverage which is shown in blue is what is above 90%. The light blue and the dark blues are all above 90%. But then you see there are the reds and the browns and the pinks. The pink is where India is, and that's 80 to 89%. There's a lot of red which shows less than 80%, and there are even 4 countries that are less than 50%. Overall, there are 119 countries, that is 61% of the overall countries, that have 90% or more coverage with the first dose of a measles containing vaccine. Therefore, the goal has not been met. Looking at the coverage of the first and the second dose, so on this slide you see 2 lines. The first one on the top, which is the black line, indicates the MCV1 or the first dose of measles containing vaccine coverage, and that's hovering around 84-85% for the last almost 5 to 7 years now. The red line that you see, which is below the black line, is the coverage with the second dose of a measles containing vaccine, which has improved over the past few years and is around 61%, but is still not optimal to achieve the goal of elimination or control of measles and rubella. The MCV1 coverage is around 85%, as I said, and the MCV2 coverage is around 61%. The number of cases that have been reported globally of measles have come down, as you can see in this graph. However, there have been around 250,000 cases that have been reported over the past almost 6 to 7 years, and that there's a stagnation. It's a flat line since that time, and there has been no decline in the number of cases. And these are all reported cases, and we'll come to the surveillance sensitivity little later on. So these are not all the cases that are happening. Just remember that there are many, many more cases that of measles that do not get reported to the system. So the actual numbers are going to be even higher than what is shown here. Looking at the second milestone set globally of reducing the reported measles incidence to less than 5 cases per million population, the measles incidence is down by 75% from what it was in the year 2000. And the line that you see is showing the global incidence per million population, and this has come down from almost 90 per million to about 36 per million now in 2015. The bars that you see are the percentage of countries that are achieving the target of less than 5 cases per million measles cases, and there are about 50% or so countries that are meeting that target, which means that nearly 50% are not, and most of the countries in this region, this part of the world, are not achieving that target. Looking at the third global milestone of 95% reduction in measles deaths, measles, as you know, kills, and it kills a lot of individuals, especially children. The measles deaths have come down by 79% overall globally against a target of 95%, as you can see in the bar. Most of the deaths are happening in 2 regions, which is the African region, which is shown in the pie that you see there in yellow, and the Southeast Asia region, which is shown in the green as a part of that circle. Although 20.3 million deaths have been prevented since 2000 as a result of measles vaccination that has happened. So while a lot of deaths have been prevented, There are still a lot that are continued to happen, and there is a need to intensify further to reduce this. So that's about measles vaccine. Countries have yet introduced rubella vaccine in their national immunization program. Although a lot of them have, there are about 150 countries or so that have introduced the rubella vaccine. There are planned introductions in 11 countries in 2017, which includes India, which has already introduced earlier this year, and Indonesia in this region that is going to introduce day after tomorrow. The rubella vaccine. There are other countries that you see in yellow that are also likely to introduce, but there are a few that have yet to introduce, and a lot of them are in Africa, as you can see, as well as Afghanistan and Pakistan. The number of cases of CRS over years, as you can see globally, there are more than 100,000 cases of CRS that get reported, and nearly half of them are in the Southeast Asia region, a lot of them in India. And these are all estimates because we do not have good quality surveillance for CRS, and this is based on models that have been developed to understand the incidence of CRS. Now, Dr. Naveen Thakkar already showed you some slides on CRS. I've also got a book, as he mentioned, that has been published very recently. This is called The Next Milestone, a Mother's Journal, and this is written by a mother of a child in Chandigarh who developed congenital rubella syndrome. And I mean, those of you who are interested in reading this, there are some copies outside, and you're most welcome to pick this up. If you need more copies, we can provide them as well. It says this is a mother's journal. Much of this journal has been written with a painful lump in the throat. Some of it has been written with eyes blurred with tears shed and unshed. Some of it has been written in anger and a head-banging feeling of frustration, a helplessness in the face of circumstances, a feeling that one is a pawn in a higher game played by the unseen deities. So this is a book. As I said, those of you who are interested, please pick one copy from outside. It describes what it took a mother to take care of a child that got CRS. So just to summarize on the verification of elimination of at the global level, as I said, there are 6 WHO regions and there are regional verification commissions that have been established in 4 of the 6 regions. Elimination has been achieved only in one region, and that's the American region, both for measles as well as for rubella, because 100% of the countries in those regions have been verified by the Regional Verification Commission as having eliminated both measles and rubella. All the other regions are making progress, and there are countries in the European region as well as in the Western Pacific region and now in the Southeast Asia region as well that have been verified to have eliminated measles. This is the measles verification status on the map. All the green countries are the ones that have been verified for having eliminated measles virus transmission. Those in red have either not interrupted or have re-established transmission. So just to summarize the scorecard against the global milestones, as far as the first milestone, as I said, only 61% of the countries have achieved the first dose measles containing vaccine of more than 90%. The measles reported incidence is 36 cases per million right now based on what is being reported. The measles mortality reduction has shown only 79% reduction against the target of 95%. As far as the elimination of measles is concerned, the target was by 2015 to eliminate in 4 WHO regions. Only one region could achieve that. The elimination of rubella again was achieved only in one region. The goals have been set by the member states of all the regions. For measles, for rubella, 3 regions have set the goal of elimination, as you saw. So that's kind of a summary of the global situation. When we come to the Southeast Asia region, the Southeast Asia Regional Committee, which is, kind of the parallel of the World Health Assembly for the world, it resolved in 2013 and adopted the goal of measles elimination and rubella CRS control in the region by 2020. The strategies for achieving measles elimination and rubella CRS control were outlined in the Southeast Asia Regional Strategic Plan 2014 to 2020 that was developed after the Regional Committee resolution. And this plan has basically 4 strategies. The strategies are immunization, surveillance, laboratory network, and support and linkages. So those are the 4 strategies that have been outlined as a part of this strategic plan. And I'll just show you a couple of slides on each one of these, and then I'll stop. The first strategy is around immunization, and the goal or the objective is to achieve and maintain at least 95% vaccination coverage with 2 doses of measles and rubella containing vaccines in each district of each country in the region, through either routine immunization and supplementary immunization activities. So the campaigns that we do are called the supplementary immunization activities. So that's the objective of this strategy. So in terms of the progress, all 11 countries in the Southeast Asia region are now providing 2 doses of a measles containing vaccine through their routine immunization. 9 out of the 11 countries have also introduced the rubella vaccine in the routine immunization, and the most recent introduction has been in India. It is a phased introduction, so it started in 5 states in February 2017 when the campaign was done, and this was supposed to be followed by the introduction of rubella in the routine as well. Indonesia is going to introduce, as I said, day after tomorrow when they start a big massive campaign again in a phased manner in the country. The only country that has yet to introduce rubella containing vaccine in the Southeast Asia region is the Democratic People's Republic of Korea. There are discussions ongoing for introduction of the rubella vaccine even in that country. Now, there have been periodic supplementary immunization activities or mass vaccination campaigns that have been conducted in the countries of the Southeast Asia region to close the immunity gaps and to respond to outbreaks of measles that have occurred in the region. Now, looking at the coverage with the first and the second dose of a measles containing vaccine in the Southeast Asia region, and looking at the cases of measles that have been reported, you can see, the red line here shows the coverage with the first dose of a measles containing vaccine, which again has been sort of flat since 2011, hovering around 85% or so, which means that 15% children do not receive the first dose of a measles containing vaccine. And when you translate that into numbers, and I'll show you that in the next slide, it's a lot of children that do not receive that. The second dose of measles containing vaccine, which is shown in the purple line, again making progress, but still not there, nowhere close to the 95% target, and therefore again a lot of children missed. The blue bars are showing the measles cases that have been reported. There has been a decline, as you can see, from nearly 100,000 cases in the early 2000s to about 25,000 or so reported cases. But as I said, since the surveillance quality is still not up to the mark, there are probably many, many more cases that are not reported, and therefore this picture, while showing a good declining trend, does not give a complete picture of the burden of the disease. There are only 5 out of the 11 countries in the region that have achieved 95% or more coverage with the first dose of measles containing vaccine, and India is not one of them. It's only Maldives, Sri Lanka, Thailand, DPR, Korea, and Bhutan that have done that. All the remaining 6 have yet to achieve the 95% with the first dose of a measles containing vaccine. And when you translate that gap into the number of children, an estimated 4.7 million children in the region are not receiving the first dose of a measles containing vaccine, and nearly 2/3 of these are in India because the numbers are so large for India. So that's a problem. And now where are these children? When you break it down into districts, You can see there are these red districts where, less than 80% of the children have received the first dose of a measles-containing vaccine. The second dose measles-containing vaccine, the coverage is again not optimal in India, although India has been making progress. As you can see, it's inching up towards that 95% mark, but it's still a lot of ground to cover. There have been campaigns that have been conducted to close the immunity gaps in 2015 and 16. In 2017, 140 million children in the region are expected to be covered with the vaccine. And then in 2018, nearly 400 million children, which is 40 crore children, will be reached with measles rubella vaccine in the Southeast Asia region. A lot of these will be in India, as you can well imagine. India is already planning to conduct or has already started conducting the SIAs, or the supplementary immunization activities or mass vaccination campaigns, covering 408 million children between 2017 and 18. About 36 million have already been covered in February, March earlier this year. Another 36 million are targeted to be covered during August and September, and the remaining 336 million will be covered during 2018 is what the plan is as of now. So that's on the first strategy of immunization. Surveillance is an important strategy, and what it reads is the objective is to develop and sustain a sensitive and timely case-based measles and rubella surveillance system and CRS surveillance in each country in the region that fulfills the recommended surveillance performance indicators. And this is important because a sensitive surveillance system is critical for achieving, this is what is going to be guiding where the virus is and what kind of strategies and policies should be developed and what kind of tactics should be taken to undertake public health response is all going to depend on the surveillance in the region. All 11 countries have a laboratory-supported surveillance for both measles and rubella. The surveillance standards have been established for the region, and 9 out of the 11 countries have either completed or in the process of updating their national surveillance guidelines, and 8 out of the 11 countries are conducting sentinel sites or CRS surveillance. The indicators, I don't want you to get into the details, but just to tell you that, there is an indicator of having a discarded non-measles, non-rubella rate, and the target is to achieve 2 or more per 100,000 population. And a lot of the countries are not achieving that at the moment. The ones that are achieving are shown in green, and the rest are all below the target, and therefore there is a big concern around the quality of surveillance. The third strategy is around the laboratory network, with the objective to develop and maintain an accredited measles and rubella laboratory network that supports every country or area in the country for measles elimination. And there is a network of 39 laboratories in the region where we have some regional reference laboratories, some national laboratories, and some sub-national laboratories, and they're testing nearly 35,000 samples for serology, for IgM testing, as well as doing testing for virus isolation and genotyping in some of these laboratories. The fourth strategy is to support and do linkages, to achieve the 3 objectives, and includes advocacy, social mobilization, communication, outbreak preparedness and response, and measles in an emergency setting, as well as research and development. Just before I close, there is a verification commission for measles elimination and rubella control in the Southeast Asia region, and all countries have a functional national verification committee which is looking at this. And the key conclusions of the last meeting that was held in April 2017 are that the 2 countries in the region, Maldives and Bhutan, have eliminated endemic measles. All the remaining countries are endemic for measles. So just to close, while there has been a lot of progress that is being made over recent years, there is a lot that remains to be done to achieve the regional goal, and the alignment of the national plans and strategies and their effective implementation and a close monitoring will be critical to achieve the goal that the region has set. routine immunization strengthening will remain the mainstay of measles elimination, and high quality campaign in India and Indonesia, as well as surveillance in these two countries, is going to be critical for the success. So this is just to show you the partnership that we have for measles and rubella initiative. A lot of partners are working together to do this. Thank you very much for your attention.